Hi, I'm Ruth Hanston, and I'd like to discuss with you the second step of the Relationship and Results-Oriented Healthcare 10 Best Practices. So you may remember that the first step is making assignments. The second step is to use a shift report process that includes the patient's 4 Ps. So we'd like to spend a little time talking about what those 4 Ps are: the purpose, the picture, the plan, and the part. This becomes a shorthand or a memory device or a common language that can be used among healthcare team members. So whether you're giving a shift report to a physician or a respiratory therapist or pharmacist or the social worker, certainly those 4 Ps can be included in the conversation. So the purpose is, why is the patient here? Why did he come for care? The picture is, what does he look like now? What does he want to look like in the future? So together, the purpose and the picture go together to create the priorities that the patient has. So the outcomes that he would like to achieve, both short and long term, or he and his family would like to progress to, are included in the purpose and the picture. The next P then is the plan. This is the map or the blueprint for care, including engagement with the patient. And then the 4th P is the part, or the roles that everyone plays, including the patient and the family in their care delivery. So when we're doing a shift handoff or any other kind of handoff along the continuum of care, whether it's from home health to the hospital or perhaps to the ambulatory care clinic, or even from the OR to the PACU to the surgical floor, that these 4 Ps are somewhere in the kind of handoff that we give. So let's contrast that then with SBAR: situation, background, appraisal or assessment, and recommendations. SBAR is a shorthand that's also used in our hospitals to help nurses, for example, report about a patient change to a physician. So the difference with SBAR and the 4 Ps includes this major emphasis, and that is, if you are giving an overview to a physician about the situation, what the background is, and your appraisal of it and what your recommendations are, you could actually miss the patient's priorities or outcomes or goals, so that it's not particularly patient-family centered. It tends to be a little bit more clinician-centered. So we would just ask you, if you're using SBAR, situation, background, appraisal, and recommendations, that you might consider making sure that there is a patient-family outcomes focus to the SBAR template that you're using. So number 2 then on our progression of best practices is giving a shift report or a handoff using the patient-family's 4 Ps: purpose, picture, plan, and part. Thank you for joining us for an overview of step 2 of the best practices of RROHC.